Hi, I'm Dr. Drew Varano. Today we're going to talk about what type of neck do you have. So there's a surgical classification known as the Dedo classification of neck types. There's 1 through 6. I'm going to go through all those and I'm going to show you ways that we can treat them surgically, non-surgically, and minimally invasive. So there's multiple ways to do things, and this list is not all inclusive, but it's a lot of the popular ways that we're using now to treat certain neck issues. And it depends on the anatomy. So once we can go through the anatomy, we can talk about what type of neck you have and what may be the best options for you. So there's 6 classifications of the Dedo neck classifications. Class 1 is a normal neck, basically. So what we're looking for is the angle to be 90 to 110 degrees is an ideal neck angle. And that's just to show you what that's like. If we take our protractor here, and this is 90 degrees, so something like that, versus 110, like that. That is all acceptable angles for the cervical mental angle. So if you have a type 1 neck, you usually have good skin and that good angle, and there's usually nothing that needs to be done. When we talk about type 2 Dedo necks, that's when we're talking about type 2 classification where there's issues with skin laxity or skin looseness. Now, there's certain ways to treat it non-surgically, minimally invasive, and surgically. Surgically, we talk about, which is the gold standard, is to do a neck platysmoplasty, usually in conjunction with a lower facelift. And this can help pull the skin and tighten the skin. So therefore it leaves a lot of less laxity. When we talk about non-invasive options, usually non-invasive options are more ideal for people under the age of 50, mid-50s maybe, and it obviously depends on the candidate. But non-surgical options, and again, this list is not inclusive, but for skin tightening, we talk about one option is doing all therapy. So all therapy is ultrasound. It's microfocused ultrasound, which heats down and deeply penetrates into the deep layers of the skin to the platysmal muscle, and it causes what's called thermocoagulation points. And what those do is help your body build new collagen to help tighten up that skin. So all therapy is a short procedure. It can be done in 45 minutes to 30 minutes, depending on which areas are done. There's no downtime, there's no recovery. You can go to work that day. It's a little tender for a day or two, but it looks normal. Second option is something called radiofrequency microneedling. And there are multiple devices that do this. Morpheus is one, Genius is another. There's probably a list of 7 or 8, but they all work by the same mechanism, and that is they have little needles that are in a stamp pattern that go over the tissue, and they heat down deep. The needles are usually insulated where they'll release energy, radio frequency energy, down to the deep layers of the skin, and they tighten up that tissue. Typically, when a treatment's done, there's not much recovery, but it's usually a series of treatments. Usually anywhere from 3 to 5 sessions are usually done once a month to help build that collagen and build that tissue. Again, there's no downtime, and usually it's done with numbing cream, so the treatment itself is back to radiofrequency microneedling on the neck. Again, it's minimally discomfort. A third option would be doing something like a filler that's hyperdiluted, and one example is Radius or calcium hydroxyapatite. And what we do is we dilute it, and it can be placed in the area, and that's biostimulatory to help tighten up and build the skin. Now again, the skin, we look at it as being 2 different things. If the skin has sag, you're going to need to tighten that up. So I attribute this as to like a bed. If the sheets are on top and there's wrinkles, then that's where lasers come in handy to treat wrinkling superficially. Whereas if something needs down deeper, that's where you need to go down and do something surgically, or all therapy can get down deep, whereas the lasers work more superficial. So the second option to do, we talked about non-invasive, we talked about surgical. And I'm sorry, the third option is something what I would call minimally invasive, which is surgical, but the recovery time is literally a couple days. And it's something I do frequently, known as Renuvion or J plasma. So what that entails, that's a 30-minute procedure where it's done with local anesthetic through 2 incision sites that are about 3 millimeters big, so smaller than a pencil head eraser, here and behind here. And what we do is local anesthetic to numb it up. Frequently it's done in combination with liposuction, so if there's fat here, I can get the fat out. And then the third step is I go in and do the Renuvion, which tightens up the skin down very deep to a higher temperature than any other device can get, and it lasts many, many years. We say at least 4 or 5 years in terms of the tightening. The fat removal with the liposuction, it's more of a permanent basis. So we can do lower necks, we can do lower neck and lower face with this. Usually the recovery is about 72 hours. You wear a compression garment. I say people could work the next day if they want to, again keeping in mind they have that garment on. But usually it's a social recovery time of about 72 hours, and you really start to see the results within a week to 10 days, and they just progressively get better and do a very good result at taking care of loose skin and fat simultaneously for the neck tissue. So that brings us to classification 3. Classification 3 for the Dedo classification is when there's submental fat. So when there's submental fat, we can treat that obviously surgically with liposuction. There is a second type of liposuction procedure that can, if it's a class 3B where the fat is subplatysmal, meaning deep underneath the fat, that's a secondary procedure that has to be done. But when talking about non-invasive options for submental fat, there's really one that we use frequently is called cool sculpting. So cool sculpting is a non-invasive option. It's usually 2 sessions that are done, spread apart 6 weeks, where it's cryolipolysis, where the device goes on, it's 45 minutes, it's painless, there's no downtime, there's no recovery, little numbness in the area, and that freezes and gets rid of the subcutaneous fat in the tissue. It does less a percentage than liposuction will do, but if you add a couple sessions back to back, you may get to some results that are close to what a surgical result could be for that area. Again, it won't tighten the tissue that's underneath there, but generally most people have good retraction there. Another option, which I'm not a fan of, is something called Kybella, which is an injectable. It's deoxycholic acid. I did it years ago, and it's just fallen out of fad. We find that there's only about 2 the average plastic surgery office does 2 treatments a year, so it shows you it's not very common. But it's an injectable of acid, deoxycholic acid, that basically lyses the fat apart. I'm not a fan of it for several reasons. 1, it causes a lot of bruising and swelling and tenderness. And number 2, it is a very expensive product that has to be done multiple times, and your money's best spent doing, you might as well just do surgery if you're going to do that. If you wanted something non-invasive, then I choose something else. So the 4th classification of a Dedo neck is when there's a muscle issue and there's what's called platysmal banding. Usually that's accompanied by loose skin. So we typically see this in older individuals, those above 45. And to treat the muscle issue surgically is what's called a platysmal plication, where it takes the muscle here and basically like a corset sews it together so you don't get the bands. What can we do non-surgically? Really, there's not many options. The only option we really have is to do Botox to these neck muscles. So that's one thing that can be done, but of course it's temporary and it'll lessen those appearance of the muscles. Now, going back to be what type of neck do you have, there's still 2 more to go. One of the ways to tell is when you want to examine yourself, or a physician examines yourself, put your tongue to the roof of the mouth. This lifts the digastric muscle up, and if you pinch, if you feel fat, it's fat. If the skin waggles, it's loose skin. And usually it's a combination. So these are not crystal clear that you're a 1, you're a 2, you're a 3. So you can have overlap. So typically a 2 is a 4, and sometimes a 3 is a 2, or a 3 is also a 4. It just depends on the anatomy, which a consultation can certainly give you the right options to do. Now, going on to classification 5 of the Dedo neck is when there is bone issues, and we talk about a retruded chin. So typically we like the chin to be in line with the lower lip here, and if it's pushed further back, it makes the neck look a little short-stocked. So there's certain things we can do to the chin itself. Surgically, you can do a chin implant, and there's 2 types. One is just you place the implant in, the other is you take the bone and pull it out, but they're both done surgically. Non-surgically, fillers work very well. So hyaluronic acid fillers can be injected into this area to make the chin more projected, which is a very easy treatment that's done. And again, there's no downtime with that. And the filler should last about a year in that area, sometimes even a little bit longer. And then the classification 6 is really not a good candidate for a surgical procedure. That's when the hyoid bone is pushing a little bit forward and downward, so it gives a short appearance for the neck. They need aggressive surgery. So that's a list of the neck classifications. And what type are you? I guess you can look at this video and find out. I do have more information on our website, www.medicalcosmetic.org, or give us a call at 202-621-8675. All our prices for each procedure are listed on the website. And I do want to point out one thing. Some people talk about neck lace lines. So these are the horizontal lines. One of the things that is more difficult to treat are those. There's really not many good options. Some people may do filler in those. That has to be a very superficial filler. I don't find that to be extremely helpful. There is a lot of recovery time when that's done, and it's not like an ideal thing. But if it bothers you enough, it may be certainly want to investigate. Again, thank you for listening, and if you have any questions, give us a call or check out our website.